therapist. I work here at Little Stars Children Hospital for CCF, Children Cancer Foundation. Basically, I work for the Hemophilia Society and I treat hemophilia patients. Now, what is hemophilia? Hemophilia is a rare bleeding disorder. It affects 1 in every 10,000 males. Only males are affected usually, and females are the carriers of this disease. Now, this bleeding disorder, it is by birth because of the genetic mutation in the genes. The males are the sufferers, as I said. So they have bleeds in the joints mostly and in the muscles. Now, bleeds in the joints occur when the joints are stressed. Now, stress can come if they are running or if they walk too fast, or that is called a spontaneous bleed. Now, if they get a hurt, that's called because of trauma. So there are levels of hemophilia, severity of levels. You have mild, moderate and severe. So if the factor level is less than 1 international units, then it's called a severe hemophilia. If it is between 1 and 5, it's called moderate. If it is above 5, it is called mild. So in severe bleeds, you have spontaneous bleeds, where spontaneity means walking also, strained walking also can cause a bleed in the joint. So when there is a bleed in the joint, there is blood accumulated within the joint. So actually when we walk also, we have certain amount of micro trauma which occurs in our joints. But our body has the capacity to heal faster because it can absorb the blood. In hemophilia, because the bleeding capacity is more, that is they bleed more and it clots less. So there is accumulation of blood within the joint. So when there is accumulation of blood within the joint, it causes the joint to swell and the joint becomes warm because the blood is warm. So when the joint becomes warm and the joint is swollen, it will be difficult for them to move, and movement is always painful for them. So they have to get factors infused. Now, hemophilia, it depends on which factor is affected or which factor is deficient. Usually factor 8 is deficient, followed by factor 9, followed by factor 11. Factor 8 you call hemophilia A, and factor 9 you call hemophilia B. Factor 11 is hemophilia C. So factor 8, that is hemophilia A, is more common than other hemophilias. So now whenever there is a bleed, the patient has to, with the reference of a hematologist, he has to get factor infused. So whichever factor is deficient, that factor has to be infused. So it depends upon the amount of bleed. So if there is a large bleed in the joint, then he has to get infusion, more amount of infusion depending upon the weight of the patient. Now, during this stage of bleed and factor infusion, we don't suggest any exercises, because if we suggest any exercises, there can be again another strain in the muscle or the joint, and that can cause excessive bleed more. So what we do is we follow the Price phenomenon or Rice phenomenon. Now, Price phenomenon is, we ask the patient, now P stands for protection. We ask, the patient is instructed not to bump into anything or not to hit anywhere. So he has to protect the joint, that is P. R is rest. He has to rest the joint or the muscle. So he should not move the joint. So even if he moves a little bit, there can be again a chance of bleed occurring. So he has to immobilize or not move the joint at all. That is rest. I is for immobilization. Ice. I is for ice. Ice means cryotherapy in physiotherapy. So you apply ice so that you reduce the temperature in the joint, that is one, and reduce the amount of swelling in the joint. So if the swelling reduces, the pain automatically reduces. Then C stands for compression. You have to compress the swelling so that there is no more space for the blood to accumulate. So that compression is given by elastic bandage or a crepe bandage, which you can get in any medical store. A crepe bandage you have to apply on the swollen joint. And E is for elevation. It stands for elevation, where you have to elevate the part, the limb or the muscle or the joint, so that there is no more blood accumulating in that area. So within this acute stage of bleed, the patient has to follow these 5 principles: protection, rest, ice, compression and elevation. So within this time, the patient is not advised any physiotherapy exercises, or if the patient does any movement or exercise, it can aggravate the bleed. So this usually, this Price phenomenon, we always follow at least for 1 week minimum, and depending upon the bleed it can extend. So during this stage we only have to ask the patient not to even weight bear. So weight bear means he should not even walk also, put weight on that. So after this stage has been, after his bleed has reduced, he will know that the bleed has reduced because there is decrease in the warmth of the joint, there is decrease in the swelling, and there is usually a funny sensation when the bleed occurs. So that will not be there anymore. So once the bleed has reduced, again he has to come to the hematologist, and with hematologist advice, if he advises for physiotherapy, he has to meet a physiotherapist. Now, because he has not been doing any movements since the past 1 week or how much time has been given for immobilization, there will be a sudden movement again can cause a bleed. So we don't advise sudden movements again. We advise a progressive slow exercise regime. So this would start with isometric exercises, meaning that you don't move the joint but you move the muscle or you contract the muscle. That is the first exercise what we give, the basic exercise, isometric exercises, followed by movement of that joint or muscle till the range he has no pain, that is till the painless range. So he can move the joint till the painless range. If he has pain, he should stop. Pain is one indication in hemophilics to say that there is a chance of bleed. In association with the CCF, that is Children Cancer Foundation, we conduct free physiotherapy sessions thrice a week, that is Tuesdays, Thursdays and Saturdays from 5 p.m. to 7 p.m. It's a free physiotherapy session where hemophilics come and exercise. They are taught how to exercise even at home. They are taught exercises over here, and they are either suggested to go back home and do the same exercises, or if I feel that they need more time with the physiotherapist, I make them to come every alternate days, that is Tuesday, Thursday and Saturday, till I feel that the bleed will not, or their muscle is strong enough, or they are able to walk better.